mission of our research team is really to improve equity and access to kidney transplantation. We have seen tremendous improvement in the last decade or so, but we still have a long way to go.
Well, right now, there are over 100,000 patients on the kidney transplant waiting list, and we only do about 25,000 kidney transplants a year. That means that we don't have enough access to kidney transplant. Part of that is a shortage of organs, but part of that is the fact that people can't get on the kidney transplant waiting list and can't get transplanted.
Some of the adverse social determinants of health that we've really seen that have impacted access to transplant, first and foremost, is really structural racism and all of the downstream effects of that. Beyond that, you see things such as housing insecurity, lack of access to reliable transportation, inadequate access to health insurance. So we have developed a really strong academic and community partnership that includes patients, it includes caregivers, it includes providers, diversity in providers, so not just clinicians, social workers, industry folks, as well as nonprofit and advocacy organizations.
Typically, transplant centers compete for patients, but since we have all really been working towards a common goal, it's been really a lot easier to build that community and collaboration to really try to address the problem together. So in the Southeast, we went from last, really dead last in the nation in the state of Georgia, to now we're ranked 42nd in Georgia for transplant rates. Our first Radiant Community study found that we not only doubled referral for transplant, but we also substantially reduced the black-white racial disparity in access to referral.
Our work started almost 15 years ago with the formation of what's called the Southeastern Kidney Transplant Coalition. We had a meeting of transplant centers in North Carolina, South Carolina, and Georgia, and other stakeholders.
So we've done, I think, at least 6 major interventions that have come out of these coalitions that have been successful in improving access to transplant and reducing racial and socioeconomic disparities in transplant. The very first intervention that our coalition did was a study called Radiant, so that's the Reducing Disparities in Access to Kidney Transplantation community study. All 3 transplant centers in Georgia collaborated to do what we call a multi-component, multi-level intervention. So we targeted the dialysis facility leadership, dialysis patients, and staff members or the clinicians, social workers, and others who are talking with patients.
Over the past couple of years, we've expanded our data collection to the New England area, to the New York area, and also to the Ohio River Valley states. So we have over 30 kidney transplant centers that submit data to us on their kidney transplant referrals and whether patients are able to start a kidney transplant evaluation.
The Early Steps to Transplant Access Registry is a project that came out of the Southeastern Kidney Transplant Coalition at first, and it was trying to address a major gap that we saw in lack of data about pre-waitlisting steps. It started with 3 transplant centers and now has grown to 34 transplant centers submit data across 13 states.
So the data collected within the Early Steps to Transplant Access Registry has been used for a number of quality improvement projects, namely Radiant Community Study, Radiant Regional, which are both focused in the Southeast. We've also used some of this referral and eval data within eStar to focus on quality improvement projects here at IU in collaboration with the IU Transplant Center.
Early in my career, my team developed Project ACTS, which is an acronym for About Choices in Transplantation and Sharing. And initially, the goal was to improve public commitment to organ and tissue donation among African Americans. But we then took those experiences developing Project ACTS and created a version of it called Living ACTS, where the focus was no longer on the general population, but the focus was on actual patients with kidney disease, to educate them on live donor kidney transplant as a viable treatment option. The initial DVD, booklet, and website were all designed to be culturally sensitive. So they're designed to explicitly speak to concerns that African American patients have voiced around interest in transplantation.
One of the other interventions that we've done on our research team was really national in scope, and this was the Allocation System Changes for Equity in Kidney Transplantation, or our ASCENT study. And we targeted dialysis facilities that had low waitlisting nationally. So there was an anticipated effect of potential reduction in racial disparities. However, there wasn't much of a plan for disseminating information about this policy change. We were able to improve access to the waiting list for this patient population, and it helped to extend the reach of this policy.
I think that a lot of these barriers that we've identified are barriers that, we may perceive to be at the patient level or the transplant center level, but really they're health system level barriers.
So oftentimes the research is occurring, but there aren't enough incentives to get it into the hands of people after the research is done. So it's really important for us that we don't just publish a paper and have it sit there. We do a lot on our team and at the Regenstrief Institute in making sure that what works gets to the people that really can implement those changes to impact the populations that really will be able to benefit.